There might be 1 in 7 people that experience insomnia, but this actually doubles in the kind of menopausal period in women. I believe about 85% of women may have those kind of symptoms of night sweats, etc., and about 65% of those will have insomnia, or sub-threshold or full threshold insomnia.
Welcome to Thriving in Menopause, brought to you by Prevention Magazine. I'm Zoe Mernier, the editor of Prevention. Thank you for joining me for episode 6 of season 11. Today on the podcast, we'll be exploring a topic that affects so many of us and that has one of the biggest impacts on our lives, and that is sleep. Or indeed, as is often the case, a distinct lack thereof. And while anyone who struggles with sleep issues can vouch for just how debilitating they can be, the ramifications of poor ongoing sleep can be much more far-reaching and serious than most of us realise, which is why it's so important to do all we can to get on top of it. To help us in that task, we are so fortunate to be joined today by Professor Sharon Naismith. Professor Naismith is a clinical neuropsychologist from the Brain and Mind Centre and Charles Perkins Centre, and is leading a world-first project that looks at the focus of sleep disruption in accelerating cognitive decline, which can lead to dementia. Professor Naismith, thank you so much for joining us today.
You're welcome. It's a pleasure.
Okay, so let's start with the sleep and menopause connection. Why do sleep issues so often crop up during menopause?
Yeah, it's a really good question, Zoe. So I've thought about this in some detail. And of course, the usual kind of culprit are, we have changes in estrogen, progesterone, etc. And I think that certainly plays a big role. We do know that these hormones do have important roles in the metabolism of serotonin and other neurotransmitters in the brain, which in turn are linked to sleep circuits and play a key role in the onset and maintenance of sleep. But there are also many other factors that I thought was worth us considering. And this includes even changes in the sensitivity of the brain to temperature shifts. So the brain might be kind of, signaling to work overtime to cool our bodies down, even when our bodies are actually at lower temperatures than they normally would be. So the brain itself is responding slightly differently, probably due to menopause as well. We also have changes in melatonin with aging generally. Right. So from the age of 40, our melatonin, starts to change. But actually there's some data that menopause probably also contributes to this as well. And melatonin plays a key role in the onset of sleep and actually even in the maintenance of sleep and the regulation of sleep as well. A big one, of course, are the relationships between menopause and depression and anxiety, when, depression is very closely linked to sleep disturbance, and as is anxiety. And then one that I think isn't talked about as much is the key role of menopause in weight gain and actually changes in the soft tissue of the throat, so that actually there's more prevalence of sleep apnea in women who are postmenopausal. Right. So the incidence of sleep apnea is actually the same in women as in men in the postmenopause stage. So this actually changes a lot during that perimenopause and menopause kind of area. So you might get about 2 to 3 times more sleep apnea postmenopause than what you would perimenopause. And that's huge, because if someone has sleep apnea, their sleep actually becomes quite fragmented. You're going in and out of different sleep stages, but also you're starving your brain of oxygen. And that in turn has knock-on effects to cognition and mood and, a whole heap of other things.
And often you don't even realise that you're sleeping that poorly, do you, sometimes with the sleep apnea?
That's right, you don't. I mean, you might find that if it's bad, you might get really excessive daytime sleepiness the next day. But, a lot of studies that we've done have shown that you can have fairly moderate sleep apnea and not actually really, that might not be a cause of you presenting, to healthcare professionals at all. But when you actually do a deeper dive, you can have sleep apnea there.
Indeed.
Yeah. And then I guess just 2 more things is that I think the other key thing is that there does tend to be a weakening of the circadian system. So that regularity of the sleep-wake cycle, that changes with age as well and may also get affected by menopause. And there's some new data that shows that sleep disruption and also menopause might be related to inflammation, or what we're all now talking about, neuroinflammation. And so maybe there's this connection here now between menopause, changes in sleep, some inflammatory response responses going on in the body, and this may kind of in turn cause a bit of the brain fog and other things that are kind of going on. That's a very novel kind of area, and we don't have good understanding of that yet.
Yeah.
But certainly I think it's more than just thinking about the changes in those hormones alone, but really looking at the complexity of factors.
And that's before you even get into the fact that someone might have a night sweat and wake up to be totally drenched and then have to change the sheets.
Absolutely.
I'm sure that's not helping.
And also with the night sweats, those vasomotor symptoms, we know that they're kind of associated with like adrenaline. So we're a bit in a hyped up stage. So if we're wakening at that time, then actually getting back to sleep again can take a little while as well.
That's what I'm hearing from a lot of people, that it's like I wake up at 3 a.m. Maybe it's because I've got sore joints or even my husband's snoring or whatever. And then suddenly, boom, I'm wide awake and I'm thinking about everything.
Yes. And of course, we're thinking about the need to go back to sleep again.
Of course.
Oh, I'm not going to be able to function tomorrow if I don't go back to sleep right now. So you get into this kind of vicious cycle with it as well.
And it's those thoughts at night also, they're just so heightened.
Yeah, that's right. And look, and it's interesting because insomnia, there might be 1 in 7 people that experience insomnia, but this actually doubles in the kind of menopausal period in women. Right. So, I believe about 85% of women may have those kind of symptoms of night sweats, etc., and about 65% of those will have insomnia, or definitely kind of sub-threshold or full threshold insomnia. So it's really significant.
Definitely. So now you're heavily involved in research to learn more about the effective methods to prevent or slow cognitive decline in older people. So what can you tell us about those risks between, disturbed sleep and ongoing sleep problems and cognitive decline?
Yeah, it's a really interesting and timely question because the new Lancet Commission report came out talking about the risk factors for dementia. When we say dementia, I'm using an umbrella term, but really kind of talking about Alzheimer's disease and vascular dementia, which are the major causes of late onset dementia and really the things we talk about with, brain aging. And there's a range of things we know are important, like blood pressure, cardiovascular health, exercise, keeping our brain healthy, depression, etc. But interestingly, sleep was not included in this last iteration of the Lancet Commission guidelines for dementia. We think it's really pivotal. There are some really good longitudinal studies showing that sleep duration in midlife is linked to the onset of dementia 25 years later. And this is even after you control for all the other things, depression and, socioeconomic status and all the other medical conditions and alcohol use and all of that kind of stuff. And we also know that there are a number of studies showing that sleep changes linked to the key protein that's involved in dementia called beta amyloid. We don't know yet how sleep is involved. We do know things like inflammation are important, but also about 10 years ago, we discovered this system called the glymphatic system, which plays a key role in getting rid of all the toxins from our brain. So it's kind of like a waste removal system for our brain. And when we go to sleep is when this system operates. So it actually works to flush out all the toxins, including beta amyloid and tau. They're the key proteins involved in Alzheimer's disease. And this happens ideally when we're in that really nice, deep, restorative and slow wave sleep. So we think that that's probably the mechanism by which this occurs, but we still have to do a lot more work yet to prove that it is, is it sleep that's causing these changes, or is it that the brain is degenerating anyway and therefore we get sleep problems? So the kind of cause and effect chicken and egg thing we haven't entirely worked out, which I suspect is why it wasn't included in the latest guidelines.
How long do you think it is till you kind of get, I know you're doing some pretty fascinating work right now. It's like how long do you think it might take to kind of get that sort of information?
Look,
or is that another chicken and egg thing?
Yes, most of us that work in the field think are kind of a bit stumped as to why some things were included and sleep wasn't, when we believe we're at the same level of evidence.
Yeah.
What we really needed are probably good clinical trials that show that if you treat sleep disturbance, you'll lower your risk of cognitive decline and dementia and, other kind of markers of brain health. And then we also need some more really detailed longitudinal studies that show that, chronicity of sleep problems in particular is linked to these kind of poorer outcomes. So that's certainly what's been kind of cited as the evidence we need. I think we've got a fair bit now, but we do need more trials and we do need more longitudinal studies. So I'd probably say, within the next few years, 3 to 5 years or so, we'll have that evidence. And that's certainly what we're working on, looking at the brain in more detail while we're sleeping and how does this relate to the flushing of these toxins and the build-up of dementia over time.
Definitely. And what are some other ways that a lack of sleep can affect our brains and bodies?
Yeah, well, one of the big ones, which I think we kind of touched on, was also the effect on mental health. So the big community studies show that the onset and recurrence of things like major depression in older people is linked very closely to sleep disturbance. One of the areas that I'm really interested in is memory consolidation. So we know that sleep plays a pivotal role in laying down our memories overnight, or even in the daytime if we were to have a nap. So, you ask someone to learn something and go to sleep and ask the other person to learn something and stay awake, and we generally find that the person who has slept after learning retains much more information. So we're really just trying to kind of now unpack that and understand what are those key processes that lay down those memories. And we think by laying down these memories overnight, we're also freeing up the brain, and in particular the hippocampus, that key structure that looks after our memory. We're freeing that up then so that it can take on board more information the next day. So sleep really plays this pivotal role in synchronizing these electrophysiological rhythms that are occurring in our brain, and then kind of taking those memories, putting them into the cortex, and then enabling us to absorb new information the next day. So that's very much an area that, traditionally has only been examined in very young, healthy people in sleep lab environments, and we're only now just trying to understand their key role in aging. Why does that process change in aging, and what can we do about it? And I think that's really important with an aging population and in menopause in particular, because if people aren't laying down their memories at night, then that's has major impacts on their work functioning, on their day-to-day life, etc. And we can look at ways of improving that as well.
Well, I think that's the key thing, because I think we've probably got a lot of sleepless women out there
now
going,
exactly.
This is worse than I thought, but what do I do? What do I do? So what should be, I guess, the first step that women who are suffering from poor sleep should take? I mean, is it a matter of sort of determining what kind of sleep disorder that they're suffering from?
I think that's important because sleep disorders are very multifaceted. So we can have insomnia, we can have sleep apnea, we can have, restless leg syndrome, we can have also what we call REM sleep behavior disorder, kind of acting out our dreams at night. And a lot of people, particularly as we get older, just complain of not having a good quality sleep. So they're awake, bits and pieces of the night, or wake up feeling unrefreshed. So it's not necessarily a disorder. It's just not as good a quality sleep as it used to be. Maybe not enough deep sleep, which changes anyway as we age. But really trying to understand that, and also even just kind of keeping a sleep diary of what's happening on a day-to-day basis. And is it that the duration of sleep is short, or is it really long, or is it that we're having, short sleep on all the nights that we're working, and then we're having kind of make-up sleep on the weekend? So I think really trying to unpack that and understand that is important. And then, of course, you can have a good conversation with your doctor about, those kind of symptoms as well.
We'll be right back after this.
Perimenopause can actually start in your 40s. Declining estrogen production during perimenopause brings on changes to menstrual cycles, and often the onset of hot flushes, night sweats, mood swings, and sexual problems. Promensal Peri is specifically designed for perimenopausal women and can help relieve these common menopausal symptoms. Promensal Peri is available at leading pharmacies across Australia and offers a cost-effective treatment at under $1 a day. When things start to change, try Promensal Peri. Always read the label and follow the directions for use.
Okay, we're back. Yeah. So what are some of the most effective ways that we can optimize sleep at this time of our lives? I mean, I guess we need to touch on the basics of sleep hygiene. I mean, I think a lot of us know it, but
yeah. We talk about sleep hygiene, really important. Major contributors to that are kind of regularity of bedtime. So sometimes we talk about you must go to sleep and get up, at the same time, but actually we talk more about getting up at the same time, because if you go to bed when you're feeling sleepy, then you're more likely to fall asleep, more quickly as well than laying in bed for hours.
Right.
So your body will kind of tell you when you're sleeping. So really not to try to overreach for, I must get 8 hours or 10 hours of sleep, but really to think about the quality of sleep. So the time that you're in bed, you want to be sleeping for at least 85% of that. And we call that sleep efficiency. So having that regular routine is important.
So you're saying, waking up or making sure that you wake up and get up at around the same time.
Yes,
that's very important.
every day.
Yeah.
That helps to set our circadian rhythm. Yeah. And then in turn, also getting lots of light in the morning is really important for our circadian rhythm, but also for our mood, and really kind of setting all the bodily functions that our appetite, everything that follow a circadian rhythm as well. So that the sleep hygiene is important, thinking about stimulants or what things are we consuming in the daytime that can affect our sleep, putting our worries away at night. So again, if we've got a stressful job, trying to have that really healthy distance between putting that away and having time for ourselves to do what we need to do to kind of de-stress, I guess, and get ourselves kind of ready for sleep.
Yes, I read something about yours that you suggest having a little worry box or worry journal where you can actually write down all the things that are worrying you before you get to bed or even in bed before you sleep.
Yeah, that's right, because they'll still be there tomorrow.
Yeah.
And there's nothing you can do about them at nighttime anyway. So there's no point kind of worrying about them at nighttime. But also some people that have stressful jobs or even just have, a lot of anxiety generally, then, thinking about relaxation in general is a good thing, but particularly before we go to sleep as well. Having really healthy expectations about sleep is important, and realistic expectations. So sleep does change as we get older. None of us will sleep like little spring chickens anymore as we get, into midlife and beyond. So really just thinking about, okay, it's okay to have a bad night's sleep. It's not going to be a complete disaster tomorrow, and not to obsess about that, because sometimes what happens is we wake up in the middle of the night and we start worrying about, sleep and how important sleep is. And in turn, that affects our ability to go back to sleep, and it becomes
the irony.
Yeah, that's right. So they're all really important things, and also even just making sure that we're doing lots of physical activity. I know we talk about this a lot. People are probably sick of hearing about it, but actually the data shows that exercise is good for sleep, particularly that slow wave sleep.
Yeah.
So keeping our mind active and keeping our body active is really important for the quality of our sleep. So again, we're focusing on the quality, not just the quantity of the hours that someone is sleeping.
Yes, that's interesting that you say mind and body, because it's important to engage in regular cognitive activity as well, isn't it, for good sleep?
Absolutely, yeah. So there have been studies showing that, more cognitive engagement is linked to with, better onset of sleep and also continuity of sleep. So, not having as many of those sleep disruptions throughout the night.
Yeah. And what is your take on sleep medication? Obviously, if people are really in a bad place, they might think that this might be a good thing.
Yeah, so I think it depends on the medication. So benzodiazepines, there's a diazepam, Valium, those kind of things. Definitely not good for people to take, particularly older people.
Yeah.
They are addictive. They should only be used for like 2 weeks maximum.
Right.
So I think that's the biggest thing. Like all of the international guidelines, et cetera, say do not take these medications if you're older. They can cause falls, they can cause confusion, and, they're not actually helpful. And of course you get those kind of hangover effects and things like that in the morning. The sedative hypnotics, Zolpidem, et cetera, they're better, but again, still not, really suitable for long-term use. Melatonin, I do recommend in that it is kind of mimicking the natural, melatonin that we have in the brain. Anywhere from, up to 5 milligrams has been shown to be helpful in kind of helping people to get to sleep, but also, again, with that sleep continuity. And actually for brain health, there is data showing that it actually may be helpful for reducing oxidative stress in the brain. And animal models show that it even may play a role in the clearance of beta amyloid, that toxin, the protein that's involved in Alzheimer's disease. So the melatonin studies, even in older people, say that they can improve sleep, they can improve mood, and they may even have broader effects on cognition. So I would say that's the healthiest option and definitely worth a trial. The one that's not considered as much are the orexin antagonists. So the orexin's like a neuropeptide involved in wakefulness, and there are a couple of them available in Australia. So they're called lemborexant, suvorexant, and they're not on the PBS. So people do have to pay for them, but actually there's some good data, particularly in older people, where we genuinely, lack data, showing that they can be helpful for sleep, for slow wave sleep, and actually the, other aspects of sleep maintenance as well.
Interesting. And what about, say, CBD oil? Where does that sort of sit on the spectrum?
Yeah, so that's a good question. There's not a huge amount of good trial data, but there was a trial conducted by my colleagues at the Woolcock a couple of years ago, I think just getting published at the moment. It might have just been published, that actually shows that it may interfere in REM sleep in those later parts of the night, which is our dreaming sleep. So people may find it helpful to kind of go off to sleep, but it may have some other disruptions to other aspects of sleep architecture. We're not entirely sure yet, what is the ongoing knock-on effects of those kind of sleep disruptions. So not sure that, the antidepressants sometimes are used, like SSRIs are used in menopause anyway. And I think the data in menopause shows that they can be helpful for sleep in some people. So, yeah.
When we know that is not good, that often obviously a lot of people use is alcohol, it can be very disruptive to sleep, right?
Yeah. So it can help people get to sleep and that they have those overall sedative effects. But if you kind of go over the limit, so I, usually kind of say maybe one's okay. It might give that, initial kind of sedative effect. But if you have too much, and I don't know about you, but I've certainly experienced this where I've had too much and then wake in the middle of the night and then you can't get back to sleep. And so it can actually have a much more profound impact on that slow wave sleep, which is the really important sleep that we want to have.
And so just on the on those medications, was there any others out there that we haven't discussed as yet?
Yeah, maybe not the medication, Zoe, but actually there's a really good evidence base for CBTI. So it's cognitive behavior therapy for insomnia. And so this is actually the gold standard treatment for insomnia, much better than any medication that's available. And there have been trials in perimenopause and also menopausal women and have shown that CBTI is effective. So it does build on those principles of sleep hygiene, but it kind of dives into them in a little bit more detail. So it even uses things like what we call sleep restriction therapy, where we really limit the time that someone can spend in their bed. It also kind of challenges some of our thinking and our expectations, etc., around sleep, so that our relationship with sleep becomes much healthier. So kind of builds on many of those things and very much, personalized to the individual, but can actually be delivered in as little as 4 sessions. And is available by psychologists, which of course people can access under focused psychological strategies, under Medicare, etc. So really worth just having a think about non-drug treatments for sleep. They're not as quick a fix as what a pill may seem to be, but actually they'll have much better effects and longer term effects as well.
That's right. That's a great option to look into. Absolutely. Thank you. Okay, so let's look at some other sort of elements of sleep, such as light therapy. Where does this come into play? When is that important in helping us with sleep?
Yeah, so light can help. Obviously, in things like jet lag, like it's a really good, evidence base for light. Also in shift work. So in any kind of circadian rhythm or, changes to circadian rhythm or any kind of circadian rhythm disorder, light is really important. So light has a really profound antidepressant kind of effect as well. So I would say it's pivotal, not only for kind of resetting our body clock every single day, but in turn that has effect on our sleep regularity and the maintenance and the quality of our sleep at nighttime. So it's important that we get bright light and that we don't put our sunglasses on.
Right. Yeah.
And get that light in the morning. The morning light is much more important even than the light that you get later in the day. At the same time, we don't want too much light at nighttime. So we want to make sure that our, houses or, bedrooms, etc., are fairly dim. Because we don't want to be suppressing melatonin. Melatonin gets released from our brain about 2 hours before we're ready for bed. So, in that 2-hour period, you don't want to be giving the brain signals that, it needs to be awake. It needs to be kind of getting ready for sleep. So managing light is really important.
Let's talk about daytime napping because you did say that they do have their place, but they have to be done right. Is that, is that right?
Napping is really fascinating because, of course, as we get older, people tend to take naps, things anyway, particularly when people retire. Napping becomes more kind of prevalent. Naps are okay to have, and the key thing is about it being a prescribed nap, so being very aware of the timing of the nap and how long the nap is for. So naps just after lunch are okay. And in fact, our body, our brains, we tend to get a bit sleepy anyway in that what we call post-lunch dip. So we have our lunch and then we have that feeling of, I'm really tired. And then you might get another little boost in the afternoon. So in that post-lunch dip, so, within 2 hours or so of lunch, that's when you can have a nap. If you have a small or brief nap for about 10 or 20 minutes, you'll have benefits on alertness and mood and other aspects of cognition for a good 2 to 3 hours afterwards. So we call it kind of like a brief nap or ultra brief nap. And so that's okay. That's probably the best kind of nap to have. If you have a nap that's longer than that goes up to 45 minutes, then you'll go into that really nice, deep, slow wave sleep. And that's wonderful, of course. We all love that. But when you wake up, you might feel a little bit groggy. That feeling when you wake up, it's like, why did I do that? I feel terrible.
Always with that daytime nap.
Yes.
And I always seem to drool for some reason. I don't know what it is. Only in
so
the day.
our brains are we start needing that really deep restorative sleep. That debt of that slow wave sleep starts to build up in the daytime. So as soon as you wake up, that debt for slow wave sleep starts to build. So you've already got a bit of that debt by the time that post-lunch dip period comes. So you will go into that if you need it. And that's wonderful. If you do have the 45-minute nap and you go into slow wave sleep or deep sleep, you will then have benefits for the rest of the evening. So if you want to hit the town and party,
right,
the 45-minute nap is fine. Right. I would do that.
Yeah.
If I, get the the privilege of doing that these days without worrying about children and babysitters and all that thing, then I would definitely do that.
Right.
You have to just be aware that that does count in your total sleep time. Yeah. So don't expect to have as much sleep that night. And if people do that all the time, then the timing of their sleep will probably start to change as well. It may become a bit later because you've already kind of fulfilled some of that sleep debt. But yeah, so in brief, naps are good, but don't have them after 3 o'clock. Keep them in the post-lunch period and just remember that they do count in that total, that total time.
Yeah, fair enough. All right. So finally, some advice for our ladies out there that have woken up at 3 a.m. or will wake up at 3 a.m. this morning. They're lying in bed. Their mind is racing. They can't get back to sleep. What is your advice to them then and there? What should they do?
Yeah. So I would say don't stay in bed for more than 20 minutes. So remember, when we wake up, our brains are a little bit wired. And so we're going to feel very alert. And so we have to kind of give our brain the opportunity to, I guess, get back into the zone again to go back to sleep. But if you lie there for more than 20 minutes, you're likely to just start ruminating and thinking about things. So best to get up, stay in a dark environment, don't turn the lights on, even just sit at the end of the bed and, in time, your brain will kind of go, this is really boring. I'm just going to go back to sleep.
Right.
Try not to get up and stimulate the brain too much by watching a horror movie or anything like that. But if you can't get back to sleep, I'd say that's okay. You will make up for it the next night. Usually people then say they, have a really good night's sleep the next night. So in general, try not to stress about it too much. Just don't get up and kind of keep stimulating the brain.
Now, another one, that was going to be the last one, but I've just thought of what happens to me a lot, is that I might wake up at, say, 4:30 and then I will really sort of feel like I'm lying there for a couple of hours. And then it's always just finally, it's probably about 5:30 that I finally get back to sleep. And then whenever that happens, when my alarm does go off, I'm always so groggy, and it's almost like, gosh, I was so awake just before. Now I'm so tired. Should I have not bothered trying to get back to sleep at that point? Because it's almost like I'm now I've woken up in my deepest sleep kind of thing.
Yeah, I'd say still good that you got some more sleep.
Right. Okay.
That's what I would say.
Okay.
I mean, the animal data suggests that a night or so is okay and the brain kind of bounces back. It's chronic sleep disruption that's more problematic. So if that was happening every single day and you weren't getting that little top up of sleep, that's probably worse than, the occasional one. So certainly if you did wake up and thought, oh, I'm not getting back to sleep, and then as a one-off you got up and wanted to do your kitchen floor, like that's okay.
Yeah.
But I wouldn't do it every day. I would try and go back to sleep if you can. And remember that you probably just have woken up in that slow wave sleep stage, which is, again, why you're a bit groggy. Probably take a good half an hour or so to get past that.
Fair enough. Oh, look, it's such a fascinating and, as you said, very multifaceted topic. I'm sure we could talk for hours, but unfortunately that's all we have time for today. But look, it's amazing, the work that you're doing. It's so interesting. And really thank you so much, Professor Naismith, for joining us today.
Thanks so much for having me, Zoe.
And that brings us to the end of this season of Thriving in Menopause. We hope you got lots out of it, and we look forward to seeing you next season. I'm Zoe Mernier. See you next time.